Thank you for coming today. We're going to be doing a presentation webinar all about the NHS app with the hope that we can teach you more about how to navigate the app, how to use it more in your daily life in order to empower you to manage your health as well. So I'm going to share my screen. We will be having a staff member monitoring the chat as well, so if you ask questions on there, she will do that, but we will have a Q&A session at the end of the presentation as well. Okay, so today's webinar, so it's all about the NHS app. Aims for the session are to help our patients understand the full range of health services which can be accessed through the NHS app, to help our patients navigate the app in order to gain more control and access to health services in a faster and easier way, and to also provide patients with an insight into future plans and goals that the practice has surrounding the NHS app. So initially we will be looking at the data and then introducing the NHS app, what it is and its services, teaching you about logging in and signing up for existing and non-existing users, app navigation, and then concluding with some Q&A opportunities. So this is a platform that we utilise in order to see where we are with the NHS app in terms of patient usage. So in June, it was recorded that we have a total of 67% of our GP patients registered for the NHS app. That's around 16,372 patients. This is quite positive for us. It's above the average, which is about 60%. Really useful for us to see, but then we can also look at the data in usage as well. So monthly logins are pretty good as well. So we've got 15,762 monthly logins. And as you can see, from February to June, there has been a steady increase in NHS logins, which is really positive to know that patients are able to get onto the app and utilise it. So in terms of actual usage of the services, we have from February to June, these are our average monthly appointments that are managed through the NHS app. So on average, 266 patients are managing their appointments through the NHS app. And then from June 2024, we had 83 patients that managed their repeat prescriptions through the NHS app. So this overall indicates to us that we have a lot of people logging into the app and being able to get onto the app and sign up. However, in terms of usage, we could sort of increase our numbers, and that could be down to not fully understanding the services, and that's what we're here for today, to help you with that. So if you would like to, I have a quick poll. I will put this in the chat for ease as well. So this essentially, we just want to know where you are at with the NHS app as well. It's really useful for us to have a look. So if you would like to take part in the poll, you can do so. We have three polls, and I'll put those all in the chat just for ease. We do have an indication that in terms of where are you at with the app, I have the app, but I don't use it. It's great that you have the app. That we understand that maybe you need a bit of support in using the app or seeing the benefits of using the app. I'll just quickly look at the second poll. So, okay, that's good though. So you know how to access some of the services, but not all of the services. And our final poll. And that's really beneficial as well. It's the sort of patient's willingness to get on to NHS Digital and utilise that app once they fully understand how to use it and the benefits. So a brief overview then. So an NHS app is a free downloadable digital application on Android and iOS device. It can be downloadable through your app store. So it was available for download since 2018. It's developed by the NHS Digital and NHS England, and it's created by the NHS and managed by the NHS. So the app gained more public awareness during 2020, during the COVID-19 pandemic, specifically the use of the COVID passport and to manage your vaccination bookings as well, and general COVID-19 support. But it is still being developed and used, and its accessibility and the goal of the NHS Digital is to completely develop it so that it is accessible to all our patients in order to utilise. So you must be over the age of 13 to use the NHS app, and you will need to be registered with the GP surgery in England or the Isle of Man in order to access a lot of the services. So some of the services you can use, so booking and managing appointments. Specifically within Lion Health, our booking for the NHS app is available from 7:30 AM. So that's when we release the appointments. We are aware that these do go quick, but at 7:30 AM on the dot, you have the best chance of booking the appointments. But you can also look at your history of appointments, so any previous appointments you have and any upcoming appointments as well. You can order repeat prescriptions and you can nominate your pharmacy. So this is really beneficial because you can pick up your medication from your specific nominated pharmacy, which is suitable to your personal location, and order and repeat prescriptions. So you can request them through the NHS app. Your doctor will then approve, and then you can go to your nominated pharmacy, scan a barcode, and they will always have that information through, and they will give you your repeat prescriptions. So you can also securely view your GP medical record. So this is really useful for specifically if you do have a long-term condition. This keeps you well informed about your health. So you can also view your test results, blood test results. You can use the NHS 111 online, checking the health A to Z on the NHS website. So access to the NHS 111 services, you can order emergency repeat prescriptions, and you can also use the check symptoms A to Z to check if you specifically need help, and you can also just access NHS 111 support as well. You can also register as an organ donor and make your sort of independent choices on sort of health, partaking in health research, also managing how your health data is used by the NHS. And then also they also have an NHS services near you A to Z as well. So logging on and signing up. So logging on for existing users, you can enter your NHS login email and password. After receiving a security code via your mobile phone, usually this is via text, SMS, you can also set up a fingerprint or face recognition. It just makes it that little bit easier every time you log in. You don't have to enter your email or password. You can just use your fingerprint and Face ID. So you can utilise this link for further information about how to log on to the NHS and help and support with that. So signing up for non-existing users. So you will need an email address and a mobile number. This is a minimum requirement. So to be able to use some of the services, you will also need to provide your NHS number or full name, date of birth and postcode in order to get your NHS number. To access your health records or any personal information you need to provide valid proof of ID. This can be passport or driving licence. You don't always need to use your ID. You can also go into the GP practice and request a access key. This is usually what you request when you set up your patient access, but it can be used instead of any photo identification if you do not wish to use that. So with setting up your NHS login for the NHS app, you will also be able to access another list of NHS services. So that's available via this link as well. You can find out a little bit more about that as well. So this is a really useful video on how to set up the NHS app. It takes you through all the steps through a visual video as well. So this just provides steps to actually how you set up your NHS login. So you will need to enter your email address, create a password, and enter the security code, again, usually via SMS text messages. So this will be a two-step verification. So you will have to provide a phone number, and then you can enter a 6-digit security code number. To access some websites and apps, you may need to provide additional information to prove who you are. So this is how we can connect you to your NHS record and protect your health information. So again, this can be used for your personal ID, or you can use your access key. So in terms of navigating the app, so this is the home screen of the app. As you can see on the taskbar, you can access services, your health, and messages. So if you go onto your health, it will come up with, this is accessing your GP health record, viewing and managing prescriptions, viewing your upcoming and past appointments, and then you can also look at your COVID-19 vaccination record and again do some of your health choices. This is again such as NHS research, organ donation, etc. So if you click on view and manage your prescriptions, it will send you to this page. So you can look at the status of your request if you've already made a request, whether it's been approved or not. You can view your approved prescription, which will be ready to look at via your pharmacy, and then you can also nominate your pharmacy as well. So further to this, if you click on managing your appointments, which was here, it will take you on to this. So you can look at your any available GP surgery appointments. So just a bit of information here. With Lion Health, you will have the option of booking a smear, pill review, or you'll have a specific type of GP appointment that will be available on the scrolling list to select if it is available. Again, our appointments are available from 7:30 in the morning. If there are no longer an option to pick a GP appointment, this means that they have gone for the day. You can also look at your hospital referrals and appointments and manage those as well. So again, looking at your health choices, you can look at being part of health research, choosing about what is shared, and empowering you to manage your personal information and data as well. So if you click on the messages here, you can also receive messages from your GP, but you must opt in. So if you go into your general phone settings, if you click then on the NHS app, it will ask you whether you want to opt in for notifications. This must be on, then you will have a central place to receive all your messages from your GP practice. This can include test results, reminders, upcoming appointments, etc. So NHS services, so if you click back on the home screen, which is here, you can look here, and this is your NHS services near you. If you click on that, you can find GP, dentist, pharmacy, a range of health services. Then if you allow location settings on, they can find the nearest service to your location. Again, allowing you to see the variety of services that are available and near you. You again can look at your health services A to Z. So this is what this looks like. And you can look at a variety of health issues. They also have this for medication as well. So if you've just been prescribed a new medication and you want to find out a little bit about that, you can look on the NHS app for this, and that is the medications A to Z information. And this one, if you've just been diagnosed or you've been referred to a different service, you can find more information regarding that service through this A to Z as well. So these are quick videos telling you how to access your GP record, how to order repeat prescriptions, etc., and on how to access and utilise the NHS app to its full capacity. We also, because this has been our NHS app week, we have been able to release our frequently asked questions and our Mythbusters information leaflet, and we also have a NHS app news bulletin available. This is available on our website, both of these. So the NHS app special is available under the news section, and our frequently asked questions is available if you go onto services, NHS digital services, and then it will be available via a link. Recent drop-in session where patients could actually come in and speak to us. So this was a picture from it, and we actually help them sort of show them the app and navigate the app as well. So thank you very much for viewing this today. Look at our website and Facebook page for further information and support. And yes, thank you very much for listening.